Welcome, everyone. Thank you for joining us. My name is Julie Cullen. I'm the Managing Editor of American Nurse Journal, the official peer-reviewed journal of the American Nurses Association, and I'll be your moderator this evening. For today's webinar, The Great FNP Barrier Takedown, Opening Your Path to an Advanced Nursing Degree, we've convened family nurse practitioner experts who will detail the critical surge in need for FNPs and all of the whys for the existing and projected gaps. They'll explore why FNP is considered the most needed of the advanced nursing degrees. They'll examine what the research shows are the challenges to nurses pursuing these advanced degrees, and they'll also discuss the potential for achieving the degree along with its recognition, remuneration, clinical respect, and opportunities in new practice venues. Before we get started, let's review a few housekeeping items. First, today's webinar will last about 45 minutes, and you can submit your comments and questions to info@myamericannurse.com. Second, a full recording of the webinar will be available within 72 hours, and you'll all receive a link by email. The replay will be available on demand for a full year, and you'll be able to access it for free as many times as you like. Let's get started by introducing our panelists, Dr. Corbett Brown, Dr. Michael Bumbach, and Dr. Janelle Sokolowicz. Before we begin the discussion, I'd like to give you a little background, starting with the Institute of Medicine's 2011 Future of Nursing Report. 3 of the 4 key takeaways from the report are related to nursing education. 1, nurses should practice to the full extent of their education and training. 2, nurses should achieve higher levels of education and training through an improved education system that promotes seamless academic progression. And 3, nurses should be full partners with physicians and other health professionals in redesigning U.S. healthcare. However, according to Fitzgerald and colleagues, advanced practice nursing continues to contend with an identity crisis in the United States. Much of the population suffers from a knowledge deficit when it comes to the skills and abilities of advanced practice nurses. In addition, many mid-career nurses perceive pursuing an FNP degree to be a daunting task. Practicing nurses may fully understand that an advanced practice degree will help them advance their careers, but they're concerned about balancing their professional and personal obligations, and they may feel isolated in the process. Research by Altman and colleagues suggests that nurses must be encouraged to return to school and then assisted when they take that step. So, in keeping with the IOM report's view that lifelong learning is critical to nurses as interprofessional practice unfolds in healthcare and as the role of the nurse changes to meet the needs of the nation, let's explore with our panel the needs, opportunities, barriers, and educational advancement strategies that can best serve nurses who want to pursue an advanced practice degree. Let's begin with you, Corbett. As we've mentioned, the report from the IOM, which, by the way, is now called the National Academy of Medicine, discusses the critical role of advanced practice nurses in reimagining and reforming the U.S. healthcare system. The report notes that continuing nursing education is the linchpin to achieving that goal. Can you talk about what specific doors are open to mid-career nurses who attain an FNP? How is their practice autonomy, remuneration, and professional recognition affected? And also, what opportunities can they pursue beyond clinical care settings?
Thank you for the question. With most nurses working in a hospital-based system, taking care of patients that need acute care, they realize that there's a great need for upstream care, for preventing hospitalizations and preventing chronic conditions from getting so severe that it impacts the morbidity and mortality of individuals. And so as nurses look around to see where they might have a greater impact on their community and along the way have more satisfaction in their professional development, becoming a family nurse practitioner is a logical choice. By becoming a family nurse practitioner, these nurses are able to gain increased autonomy in decision-making, in delivering care to individuals and to their communities, in preventing disease processes, in promoting health, and in changing the quality of care in their community. Because it's a change in the type of nursing care they're delivering and really the the location of care, moving from the hospital to an outpatient location, the nurse who becomes a family nurse practitioner is moving towards direct measurement of the impact of the care that they deliver. And so through that direct measurement, we can look and see how nurse practitioners on the individual level are impacting the care and the health of individuals in their community. And increasingly, that's tied to remuneration. Currently, nurse practitioners are making on average $112,000 a year, which is a significant increase from the average of an inpatient floor nurse. So there's a salary increase, but I think what really drives nurse practitioners or nurses to become nurse practitioners is the ability to drive changes in care. And that transition from taking care of individuals that could have otherwise been prevented from developing more severe disease and landing in the hospital to, moving upstream and, changing the trajectory of individuals and communities in terms of their health and health outcomes. And along the way, these nurses that become family nurse practitioners have lots of doors that are open to them. The three main doors that open are in terms of driving, as I mentioned before, the quality of care that's delivered in a clinic. The second door that's opened is in terms of academia, being able to train the next generation of nurses and nurse practitioners. And then the third door that's opened is in terms of clinical research, where nurse practitioners can partner with researchers and drive research projects within the clinic that have a direct impact on their patients, but as well as patients generally.
Michael or Janelle, do you have anything you'd like to add?
I'd be happy to. Thank you for having me. This is a very interesting question, and I can really only speak upon what I see with our students at the University of Florida, what I've experienced with myself. The step to advanced practice to me was the next level. I had a great career. I was an ER nurse, and I got to a point in my career where I said, I need more. So I was at a point where I needed more in education, I needed more learning, I needed more, the next challenge. Advanced practice nursing allows for that challenge. And what's unique specifically with the family nurse practitioner program is it opens the doors to a wide array of patient clientele. It could be pediatrics to geriatrics. Here in Florida, we have our fair share of geriatrics, and it opens the door for that continuation of care. And you have enough experience, you have the clinical background, you'll have the nursing background, which you'll always carry with you going forward, but it really does allow for that next level, what I mentioned earlier, that increased autonomy, the opportunity to kind of work out of the hospital. I know for me that was huge. When I was younger, we were starting our family, and we were looking for opportunities. I was looking for better hours. I mean, the tertiary hospitals are open 24 hours a day, 7 days a week, 365 days a year, full time, and you're going to get shifts all through that. When I became a nurse practitioner, it was like a breath of fresh air. I became a nurse practitioner, and I started the clock at 7:30, and I got off at 3:30, sometimes 5 o'clock if I had a really busy day. But it allowed for better opportunities for me, for my personal life as well. What we try and tell our students, too, is to keep your horizons open, right? So the advanced practice is your clinical backgrounds, but here at the College of Nursing, what we do is we teach all of the other paradigms with it. So we teach our theory, we teach our statistics, we teach our business, our analytics, and that opens the doors to so many different parameters, so many different opportunities. We have nurses that own their own companies. We have nurses that are in partnership with other healthcare providers. We have nurses that are entrepreneurs that have come up with applications. We have nurses that go into education, that go into full-time research, and the family nurse practitioner track really does open those opportunities for that.
Thanks, Michael. Thanks, Corbett. Michael, I'm going to throw this next question to you as well. What are some of the factors that are driving the current and projected increase in the need for family nurse practitioners in the United States?
There's a very significant factor here in the state of Florida, and it's really no surprise. Studies and trajectories have shown this over the past 15, 20, 25 years. The number of retiring baby boomers coming to the state of Florida has gone up through the roof. I saw a report on the news a couple days ago, and it said here in the state of Florida, we're getting something like 10,000 people moving into the state per day. Well, that's obviously going to put some strain on the infrastructure of healthcare, not only healthcare, but everything, everything that we do, food, travel, transportation. That number of baby boomers going into retirement has not only been projected, but now we're getting to that level where we're starting to see that into our healthcare system. So family nurse practitioners, being that they have the opportunity to take care, to monitor, manage, and to successfully treat the increasing population, that allows for a lot of great opportunity for nurse practitioners, for family nurse practitioners throughout. We noticed also back in 2010 with the addition of the Affordable Care Act that the healthcare access to insurances had opened up. And when they had opened up as well, we needed more professionals to take care of the folks that were into the healthcare system. So family nurse practitioners are at a unique spot where they can jump in and they can go ahead and help out with patient care, jump in throughout the family, the lifespan, and take the opportunity for that.
I'd like to piggyback on that. At WGU, we really focus on the underserved, equity and access, and I see the FNP also in the response to rural health. Post-COVID, we can recognize, and we have done some research as we're thinking through our strategies, and post-COVID, the number of rural communities who have had hospital closures, who have lost psychiatric and mental health services. And so, the FNP need is dire in the rural areas, as there happens to be in Missouri. There are about a quarter of the state where there's not a practicing psychologist or psychiatrist within, 50 to 100 miles. And so the psychiatric FNP is significantly needed throughout the country. And so this particular need is not just, relevant to the age of the practicing nurse, but also the post-COVID pandemic need to support rural America and to support those areas that now have had closures of hospitals. It's significant, and it's imperative as we think about our need and our response in nursing education to fill those gaps.
If I could continue with that, that's a very important fact, because what we've noticed, and the studies have shown, that physicians actually live and practice within 7 miles of where they live, but they tend to center in the urban centers. Now, of course, that's a large generalization, but there's a significant amount of primary care physicians in the urban centers across the United States. A couple years back, we did some research with some GIS mapping, and the PI to that research, Dr. Donna Neff, who's now with the University of Central Florida, we looked at the differences from nurse practitioners, specifically family nurse practitioners, to where they were living, which also indicates where they practice. And what we found is there was a significant difference for family nurse practitioners and nurse practitioners in general in the rural settings across the United States. So when we educate and we send back the nurse practitioners after they graduate from the education systems and they're out practicing, they tend to return and practice in the areas where they're from. And that's a significant difference from where we see just healthcare, primary care across the United States. And that mapped out quite nicely when we looked at the maps of locations of practice and then also the spots where they live.
Thank you. Janelle, I'm going to throw this question to you. I'd like you to talk a little bit about the knowledge gap in the United States among patients, the general population, and also within the healthcare community itself when it comes to the skills, proficiency, and training of advanced practice nurses. Also, I'm wondering what role nursing education programs can play to better educate the public and healthcare professionals, including nurses.
So, most nurse practitioners have heard of the seminal work of Brown and Olnetsky. They posit they have this entire outline of limbo to legitimacy about novice APRNs. And I have an idea that part of the, being a novice and what they found in their research, their lack of confidence as they begin their practitioner role actually directly impacts their ability to truly exemplify their skill impacting the patient care community, meaning the perception of the community, half of that has to be with how our new APRNs demonstrate confidence in what they do, right? They go from learning that they diagnose to a point and then become an APRN and they're able to diagnose fully. And that, I think, is part of the challenge within the community. On the other hand, I will say from a positive perspective, we went from around 90,000 nurse practitioners and APRNs in 2010 to over 290,000 now. So, and we have close to 70% of nurse practitioners serving as primary care providers now. So I think it's changing. I think it began with a lot of policy and lack of states to allow practitioners initially to have the extent of prescriptive authority that we have now see improving, right? Not perfect, but improving across the nation. But also the confidence level of our advanced practice nurses. And so one of the things we really focus on at WGU is making sure they feel confident in their ability and also have the support to gain that confidence, because we know that's part of the communication to the community at large is their confidence in feeling legitimate in their ability to perform as a practitioner. And so I think that's part of it. When we talk about messaging, and specifically the mid-career nurse as they think about pursuit of an advanced practice degree, I believe our education programs have to do a lot more to ensure the public is aware of the value of the NP. I talked about one of those values, which is meeting the need of psychiatric mental health services. But overall, rural health in overall, right, with 90% of the U.S. being rural and 20% of its population living in rural areas, but we have an entire plethora of critical access hospitals that are closing, as well as physicians that are moving back to the city. And we need to work as programs, as health professions programs, to connect to the over 1,800 rural hospitals, to really work on building these pipelines to developing nurse practitioners where they live. I also think it's important for us to create opportunities and pathways that provide some support from organizations, scholarships, tuition reimbursements. Because one of the things you talked about as we began is that oftentimes the mid-career nurse is a little resistant to starting because they have a family or they have they're a caregiver. They have a lot of other responsibilities. And then post-COVID, as we know, specifically for women of color post-COVID and nurses of color in particular, it was a study just done about nurses of color post-COVID, financially were impacted even more. And so they may, in their mind, say, I really want to move forward in my career, but I can't because I am in a new dynamic financially. Now, of course, most things that you get, financial services, are on your previous tax returns, right? But you have a nurse who is, working and they're doing well on paper, yet their entire life has changed because of the pandemic, and they're maybe now the primary provider for their family in their same home. right? And so in order to promote, to really, first, what's very important to me is growing the diversity within nursing, and part of that is creating opportunity, which we're calling on higher education to do that, creating scholarships, tuition reimbursement, motivation to give that nurse an opportunity to change their dynamic, to change their flexibility, to change the ability for them to be able to afford, to live and to develop professionally. But we have to create the opportunities, and we really pride ourselves on that at WGU and making an affordable opportunity for students to finish their degrees. But my challenge, of course, is to all higher education, all nursing programs, to create opportunities for the mid-career nurse who may be sending children to college, may be care provider. It's up to us to create pathways for these students, to help them get the support they need, the financial support they need in collaboration with organizations and businesses, and to really, rally, even with our government, to ensure that we are helping these nurses get to that next level in their career, right? We have to create those stepping stones to help them make that decision to continue their education, to not just for themselves, but for our country, and to help our entire country meet the demand that we'll need and have the health services that it so desperately needs, specifically in our underserved areas, underrepresented populations, and really to advance diversity in nursing. And all of these things really go together, but a lot of it has to do with us creating those pathways and partnerships and creating affordable education opportunities.
To piggyback on Janelle's statement, I think that there are opportunities for nursing generally and for nurse practitioner programs specifically to strengthen our messaging and our marketing directly to students or prospective students as well as to the community. And for example, nursing in general for 19 years straight per Gallup has been ranked as the most trusted profession in the United States. Trusted in terms of honesty and in terms of ethics. And that's without a national campaign of, where the nurses were the most trusted. It's just through the organic relationships that nurses have with individuals and with families and with communities, to where that human engagement leads to a very high level of trust. And so we already have a strong basis to build on trust with knowledge of what nurses can do and what nurse practitioners can do in driving change in healthcare. And there are great opportunities, as Janelle mentioned, in terms of reaching communities that haven't had care, communities in rural areas, communities in urban underserved areas, communities that have had underfunded services for generations. There are great opportunities for us to break down barriers and build lasting partnerships of care.
Thank you. I'm curious to know about how current online learning environments can help overcome some of the professional and personal obstacles that may cause some mid-career nurses to be a little ambivalent or reluctant about pursuing advanced degrees such as a FNP. Corbett, could you answer that question?
Yes, thank you. So as a preface, it's interesting to me that a lot of the sleep deprivation studies are done on nurses. And these studies are conducted using nurses because nurses try and do everything. So we work, we play, we have our family time. We don't want anything else to suffer. We prioritize everything above our own sleep. And so prospective students, they're already juggling a ton. And so with online education, it allows that student to prioritize what's most important in their life and to be able to fit in the time to study, this time to learn. So WGU, we're known as, our mascot is the night owl. And that's because a lot of our students are juggling quite a bit. So they're juggling their job, they're juggling their family responsibilities in their community, and they're fitting in time to pursue very rigorous competency-based programs and thrive in that environment. And there are a couple of reasons they can thrive. And it's because we focus on making sure we meet the student where they are in terms of time and place. So traditionally, education's been structured around time and forcing the student to fit the timeline of a specific program and the place of the program, where online education flips that and says, we're going to be student-centric, and we're going to meet that student where they're at, in their living room, at their kitchen table, early in the morning, during a break in the middle of the day, or late at night after the kids are put to bed. And we're also going to meet them in terms of cost. We're going to drive down the cost of education so that it's affordable. So the two biggest hurdles that we help students to overcome are those barriers of time and cost. And by doing that, we're able to help a new generation of students gain their training in their local community. Rather than having to train in an urban setting, they can train in that rural town and then be prepared to serve the community in that rural town. As an aside, as was mentioned by Michael earlier, that a lot of practicing physicians are in urban settings, and generally they predominate in more wealthy urban settings. And it's related to the training pipeline, to where a lot of the medical school programs are in urban settings, and the residencies are also in those urban settings. And there's quite a bit of research that physicians partner with other highly educated individuals. And so even if they do come from a rural or underserved area, it's hard to go back to that rural or underserved area and find two good jobs for two highly trained individuals. And so it becomes a barrier to going back to the community from which they're from to serve, where online education allows our programs to reach out to those communities and train individuals where they're at, to where they don't need to leave their community. They can stay embedded in their community and be trained up to be the servant of their community.
Thank you, Corbett. Janelle, are there any specific innovative approaches to alternative clinical learning sites and experiences that are having a particularly transformative effect in preparing nurses in advanced practice programs to achieve the National Academy of Medicine's vision of nurses at the heart of helping to revolutionize U.S. healthcare?
I think we can say post-pandemic created a revolution in and of itself of innovation, right, in technology. And so what we've learned is through the use of virtual simulation, augmented reality, and telehealth clinical learning, it's been turned on its side. And we've been able to really step out from what, we perceive as the norm and challenge the future. We have created alternative opportunities using, healthcare partners and other partners across the country, and using virtual simulation as it's never been used before, and telehealth as it's ever been used. I think that we have to continually think of the next innovative method to educate across the nation to really fill this gap of FNP and other advanced practice nurses. It's imperative. And we've done our great work in really trying to leverage telehealth, using preceptor relationships with oversight and alternative preceptor considerations of alternative preceptor processes. We've really tried to get very innovative and determine some key alternatives that would allow us to still continue to fill the pipeline. And it's been difficult, for sure. And that's where I think it's important that we are talking about this, because we need partners, right? We need those tech edge, innovative partners that have thought through this and maybe haven't walked into the healthcare space to really help propel us forward. you know, and we use so much technology for so many things, and you know, we think of it and then we maybe let it drop, and that's where I think it's really a call to arms and action for everyone. It's important that we advocate for it because these alternative clinical learning, you know, experiences and solutions have to be managed and they have to be developed quickly. We are doing our best, and we are really stepping out of the norm. We have definitely revolutionized in the idea of telehealth and virtual simulation and augmented reality, and we've worked very hard to see exactly where we can, you know, move to the next space, and what does that look like, and what are the tools that we need, and how can we expand access. But we've also learned that access to the internet and technology was a key opportunity for us. And so I think there's still a lot of work to do for sure, and I would love to hear more about, you know, what our partners in Florida are doing and what other healthcare, you know, education providers are doing, because I think this is something that we all need to partner in to really build a strategy that is sustainable and can be supported by both physical campuses and online programs.
So I'd like to go around to each of you. I'll start with you, Michael. Is there one key benefit of an advanced nursing degree like an FNP that you think is least known or underappreciated by mid-career nurses?
That's a great question. When I talk to my students and when I reflect back on my work experience, I got to tell you that first Christmas where I was able to be home and I was able to spend time with the family, spend time with the people that I valued, and at the same time too, I was still on call, so I was still productive. I was still able to work, and I was still able to shift my focus out of the hospital. I think a lot of folks don't tend to talk about that. You know, we talk about taking our education to the next level, taking it to the next point where we're able to learn and we're able to continue to grow and we're able to continue to do more complex, different patient care. I think that's all important as well. But it's the little things that help out, right? It's the little things that make the family nurse practitioner role so attractive. It's the opportunity. It's the ability to open the doors after graduation. If you want to gain further experience, you have the credentials, you've got the ability to do that. It's taking the education and utilizing it to grow professionally. And when I talk to my students, that's their main motivator. That's their main piece that brings them back into graduate school. We have the Doctorate of Nursing Practice, so the DNP degree opens the doors to so many things. Like, as we talked about earlier, and it was mentioned, research, education, entrepreneurship, and so on and so on. It's those little things that tend to add up. And when a nurse goes for their advanced practice clinical degree, those are the things that keep them in the role. I don't know many folks that have gone to nursing to FNP and then to nursing, right? So they tend to stay in that role, especially with increased satisfaction, increased efficacy, increased autonomy, all of the factors that allow the nurse to be happy in their role.
I totally agree with Michael that there are so many social benefits as well as professional benefits of transitioning from registered nurse to a family nurse practitioner, and the professional benefits extend lifelong. To stay on top of medical research and literature, and so that you're always driving evidence-based care for individuals and families in your community. And I totally agree with Michael that it opens up the opportunity for the family nurse practitioner to be an innovator and an entrepreneur. So with our programs being so cost-effective and so affordable for students, the debt that students carry is minuscule, and at times it can be none, because we structure our programs to where students can work through the programs they're so affordable. And so that reduction of debt load and allowing our students to be free of that financial pressure allows them to seek out practice types that suit their desires, that suit their needs, and to actually drive innovation within a practice and to open up unique types of practices that fit or serve their community in ways that they've never been served before.
So to me, I think the entrepreneur is really what I think many times the nurse doesn't think about. Years in the hospital, we would have nurses selling different items as well as working and doing anything to make a little bit of extra income. And I think if they understood that this decision to become an advanced practice nurse allows you to become a business owner, right? In many states, you can own your own practice and work with some autonomy and ability to have your schedule and your life and your family and really truly make an impact on healthcare and the quality of healthcare that's provided, to really change the trajectory of some of your patients that you've cared for, that you've seen in just a simple follow-up, to provide that level of care that we pride ourselves on within our profession, and to be able to change families, to support whole families, and do that through your own business. So I think we think about the care aspect. I think we think about advancing professionally, but think about being your own boss, and really allowing yourself to push yourself beyond those different bounds that you've created in your mind. There's just a great opportunity, and it's really the door's open. It's there. You got to step through it, and really take that next step forward in considering where you want to be 5 years from now and how we can get you there. It's up to us in higher education to provide that education, and it's up to the nurses to make that decision.
Those are all fantastic points, and I couldn't agree with you more. And I tell my students a lot of times as well, I got excited. I got really excited going to graduate school. Because as a nurse, you work and you follow your orders and you take care of your patients and you have your patient care and you do everything to the protocols. And as we talked about, you're on hospital schedules, you're on, maybe you're working as a nurse in an outpatient center somewhere. So the timing is definitely a benefit as well. But what I got most excited about is when I went to graduate school to become a family nurse practitioner, all of the things I started to piece together in my head, working in the hospital, working with admin, working with budgets, working with clinical factors, working with evidence-based practices, all of that started to really take shape. So I remember sitting in class, and I was in a research methods class, and I thought to myself, holy cow, this is what I knew was there, but I just didn't know how to piece it together. So I didn't know how to do the research, or I didn't know how to do the QI or the QA protocols, or the QI quality assurance measures to be able to test out something that I see it's an absolute problem. Or I sat in a health policy course and we talked about laws and litigation and the things that are important to the lawyers that are kind of always overarching us. Or I sat in a health economics course and we had to construct budgets for floors or construct budgets for a simple clinic. Or I took a business class and we did a business plan. I mean, those are the things that I started to put together, and then I moved forward in my FNP career, and then that became so useful because, like I believe Janelle mentioned, we are so focused on the clinical side of things and evidence-based practices, but you'll tend to find out medicine doesn't really change rapidly. It tends to be things tend to move like a barge, like over time. And yes, guidelines change, and you absolutely need to be up to date on guidelines, and they may change depending on what you do, every couple months or every couple years or, maybe even longer. But there's other things that we can be focused on as well. I don't know too many people that get happy with a budget unless you're making money, and that's all important as well. Or a business plan. When you put together your first business plan and you're able to put together a product or an idea or an application that you are in clinic and you've just experienced an issue or a problem or you've seen a real need for, that's when this advanced practice degree education and experience really starts to take shape and to take form. And that's where we become change agents in the community. The family nurse practitioner is in that position for that. And there is absolutely nothing wrong with any of the tracks of advanced practice. We fully support each other, and we should act as a team, and we should come to the table together as a healthcare community. But the FNP, because we're so diverse and you have the education and the experience to be able to be in so many different markets with so many different patients, with so many different environments, it really opens the doors to, the world's your oyster. You can come up with whatever you can come up with, and that's the beauty of it. I've seen students, and it's I love it when the students come to the table and they're doing their DNP projects. And at the College of Nursing, we have one-on-one mentorship with the graduate nursing students with the DNP projects. And I love when they come to the table and they said, I get it. Dr. Bloomberg, I get it. Like, this is what I need to do. This is where I need to change. This is where I need to go forward with. And that excitement, I love to see that in the graduate program. And I think all of us have experienced in some way, otherwise we wouldn't be in our careers as we are at.
I completely agree with Michael there that the family nurse practitioner has such a broad educational background and foundation for delivering care to individuals throughout the lifespan. And so it creates this foundation upon which we can build. So as we look to the future, so the National Academy of Medicine is going to release the next report this upcoming May. And while I don't know what's in the report, my hope is that it suggests building blocks upon the FNP and other nurse practitioner degrees for future practice. And what informs that thinking for me is the work of the late Clayton Christensen and disruptive innovation. And disruptive innovation is where a part of the market segment is currently underserved by the incumbents, and a new competitor comes in and starts serving that portion of the market that's kind of overlooked and undervalued, and starts to move upstream. So one of the best examples of this is in the steel mill business, that the traditional steel mills were focused on big I-beams and large steel components that were high value and high margin, and overlooked things like rebar that they viewed as low margin and really not worth their time. And so mini mills came in to the marketplace and started making rebar, and the incumbent steel mills weren't threatened by that competition, because in their view they weren't competing on the big margin ticket items like the I-beams. But over time, those mini mills were able to build competencies to where they moved upstream, and eventually were able to make the same I-beams, the same steel components that the big steel mills were making, and disrupted them through that innovation, that disruptive innovation. And so I view nurse practitioners as being the same. So traditional medicine has built the clinic systems in areas that are more affluent, and the rural areas and underserved areas are the ones that suffer. Unfortunately, they are the communities that are treated like rebar, that are overlooked. And so as an example, you'll have two zip codes, one right next to the other, where one is more affluent and has greater access to healthcare, and the life expectancy in that area compared to the neighboring zip code that has less access to healthcare and less affluence can be 10 to 20 years in terms of life expectancy. And so my hope is that as we've taken a foothold in terms of primary care, and especially in delivering primary care to rural and underserved communities, that we can start moving upstream, that we can build upon this really solid foundation that is a family nurse practitioner graduate and a family nurse practitioner degree, to building on fellowships that will help train that nurse practitioner to then move into a specialty focus to serve that underserved community. Because we need primary care family nurse practitioners that can, as Michael said, work in pediatrics, women's health, full family care, internal medicine. They can work in any of the primary care clinics. And as we add that specialty training, we can empower them to move in their professional career even further to then deliver endocrinology, orthopedics, cardiology, pulmonology, other services that are in equal need in the community, and we can do it at a lower cost. And so there's a great opportunity for us to follow Clay Christensen's model of disruptive innovation and move upstream and deliver the services that Americans need. As Janelle said, there's been a shakeup with the pandemic, and things that the traditionalists said that could never be done are being done. Regulations that we were told could never be loosened are now loosened, allowing nurse practitioners to practice to the full extent of their training and education. And so as we are able to deliver additional training and education, we will make an even larger impact on the communities.
Thank you, Corbett, and thank you, Janelle and Michael. Okay, audience, we're ready to start answering your questions. We'll try to get through as many as possible in the time we have left. Okay, so let's start with our first question. I'm going to throw this one to you, Mike. Here it is. Is there potential at the FNP level to leverage bedside care to the wider community at large? For example, providing disease prevention and health promotion and bringing improved patient outcomes to diverse and often underserved populations.
Absolutely. First and foremost, thank you for having us. What an interesting topic, and a lot of need across the United States. I know if any family nurse practitioners are interested, or any potential FNPs are interested in Florida, there's a huge need, but there is a huge experience that nurses carry inside the hospitals. They run the show, right? So a hospital is not a hospital without a nurse. So that bedside experience, that technological experience, the experience of patient education, of being there with the patient, that experience that's a rich wealth of experience that you can take into the FNP world. Healthcare, shall I say, even like a specific disease like liver failure. Liver failure is liver failure, right? It's bad in the hospital, but it needs to be managed in the outpatient. So that experience of the inpatient going then to the outpatient or to a primary care setting or to a family care setting, that's all a very strong wealth of information that you take with you. And if there's any kind of wavering of confidence of somebody that's thinking about an FNP program or thinking about taking that next step, don't ever underestimate your experience that you have in the hospital with patients, with the healthcare team, with other nurses. And that experience absolutely translates over into the graduate world as well and is extremely needed. Because imagine knowing that bridge, knowing that link between the tertiary to the outpatients, to family practice, to primary care, to urgent care settings, or whatever it is. So that leverage, I would say, use it and take it to the next step, take it to the next level, and see what you can do with it. Thank you.
So I'll take the next question. Corbett, I'm going to throw this one to you. And Mike and Janelle, feel free to jump in too to answer this if you'd like. Are there specific approaches with alternative clinical learning sites and experiences that are having an effect in preparing nurses in advanced practice programs to achieve the IOM's vision of them at the heart of helping to revolutionize U.S. healthcare?
Great, thank you so much for the question. And really, we're at the frontier of using alternative clinical education models. Up until present, the main measure of students' competency is the clinical hour. And there are really kind of two areas in life that we measure change by hours, and that's in education and in incarceration. And in both, it's actually it's a very surrogate measure and a poor measure of either competency or change. And in fact, recently there's a push for all programs to measure competency based on competency and not on hours. And so that's going to open up a wide avenue for alternative clinical learning experiences, whether that's through telehealth, augmented reality or virtual reality, and other technologies that are yet to be conceived, to allow students to build competencies and then also to test those competencies. So we'll move away from the clinical hour as being the best measure, or we should say the only measure of students' competency, and towards actual direct measures of competency using technology. As an aside, with COVID-19 and the pandemic affecting so many aspects of our lives, we've seen how regulations have been loosened, and we talked about that in the webinar. And the regulations were loosened because the way that things were done before had to change. And we saw it in so many aspects of our lives where previously individuals or groups would say, no, we can't change the way things have been done. We can't do it differently. Overnight, and literally over weeks and sometimes days, systems had to change the way they performed, the way they educated students, the way that they reached individuals and patients. For instance, with telehealth, there were systems that couldn't function because face-to-face clinic visits were prohibited. And so in some of these systems, they had previously stated that, no, they couldn't use telehealth. And literally overnight, and literally over the course of a 3-day weekend, they were able to set up telehealth services. And we've seen the same thing across the nation in terms of education, that in programs that no, we really can't teach these didactic courses using online model. Some of those programs were forced into online education. And the benefit with WGU is that's our bread and butter. We are set up to reach students where they're at in time and place through online education that measures their learning and their competency directly. And so it's not tied to the hours, it's tied to competencies. And we are prepared to leverage all of the new technologies to meet our students' needs and to meet the needs of FNP students, to prepare them to work with their community.
This is Mike. I just wanted to make a comment. I think that's fantastic. And I think if anybody's looking for a program for graduate school for an FNP or any kind of advanced practice nursing, consider not only the technologies, but what technologies are we willing to try. So, I mean, there's some technologies that are out there that are absolutely fantastic, and we can all, lean on them, and they help build competencies, and they help build simulations, and so on and so forth. But there's some other technologies that may not get us to where we need to be. So what's nice about us is I think nurses are very much in this ballpark altogether. We're willing to try it, but if it doesn't work, then we're going to look to something else. But in the meantime, then, that evidence-based, that research-based practices are so important. I know at the University of Florida, so what we do is we push as much research and evidence to support whatever we do, because that's, of course, important. But then, as Corbett said, COVID kind of backed us up into a corner. So we were kind of forced to say, what else is there? What else can we do? Let's look at some alternatives. Let's see what else is out there. So, for folks coming into a graduate program, or even for folks looking for faculty positions, the opportunities of advancing or moving into these technological frontiers are absolutely there, and they're here, and they're not going anywhere. As we know from nurses in the hospital, with electronic medical records. I mean, 30 years ago, that didn't exist. In the outpatient world, I distinctly remember moving to electronic medical records and just bemoaning the fact, but also recognizing that it's not going anywhere. So there's a lot of approaches that we can jump into, we can try, we can leverage, we can tweak as needed, and nurses are very much in that kind of front line to be able to make it work, or to say, hey, we need to reconsider this or reconfigure this. I would say as a faculty member in a graduate program, that's one of the main things I enjoy is trying to figure it out, making it work. What's the research? What's the evidence behind it? Making it move forward.
Hey, it looks like we have time for one more question. Janelle, I'm going to throw this one to you. What are some of the key improvement strategies to engage and encourage mid-career RNs in their professional career aspirations?
Yeah, it's funny. Actually, the Robert Wood Johnson Foundation did a fantastic study on those barriers and motivators, and so there's some really great evidence. You know, one of the big motivators they found through that study is that improving social welfare, that was huge for the nurse, being a positive role model for their children. That was another motivation. And then wanting to accomplish those personal and job satisfaction and professional achievement. And they actually found that nurses with graduate level degrees were more likely to state that they were extremely satisfied with their job and to stay at their job. And so those are some of what they found as the motivators. But one of the barriers that we found that I think is important for us in higher education to truly understand were cost and family and children. So, as care providers, they did not want to put their children aside to be able to complete their education. And then their second most prevalent response was cost, and lack of time actually came in last. So as much as many times in higher education, we think it's because the student may not have the time, from this research study, which was a good, a validated study, it found that really cost was almost number one, family was second, and time was third. So I think when we think about what we're going to do to really motivate that mid-career nurse, it's to ensure that the cost of education is either supported through scholarship, tuition, grant, or that we ensure that higher education understands this and creates costs that they can afford, right? Works with partners and hospital systems to build collaborative relationships to make sure that those nurses are able to go back to school and not, add any more debt on, because many nurses in their undergraduate, in some using some type of financial aid, and so they don't want to add on to that. And so in that we know cost of education is a major barrier, we need to really work at developing those incentives for scholarship and financial incentives. And then when we talk about the family, it's really how do we create an opportunity for a person to complete their degree program, ensuring that they have childcare or support for their children while they're doing it. Online education has allowed us to have the opportunity to go to school 24 hours a day, 7 days a week, and to be able to have the flexibility to be able to support our family. When I was still teaching in the classroom, I would always say, I want you to do a real-time calendar, So if you, go to church on Sunday, if you, go to Mass on Saturday night, whatever it may be, put that on your calendar and set your family time, because they're not going away. But and then still understand exactly how much time you have to study, but that takes time, right? And so we really need, education facilities that really understand the life balance and have dedicated structures for helping students manage that life balance. And then that can also help with the time barrier, right? So those are real things. And then also considering the impact of the social determinants, things that nurses of color and nurses from underserved populations may have different things on their plate, right? And so part of the study, they also looked at nurses in rural settings who were having more than one job, right? And so, yes, the motivation was to get them to go back to school, but they're in a setting in which because of where they are financially, they maybe need to work more than one job. They have more than one nursing job. And so that's important, right? working day shift, working night shift, voluntary overtime, involuntary overtime. So there's just some circumstances that we have to be aware of, and I think those are things that we in higher education can mitigate. As we focus on nursing education, as we focus on making nursing education more diverse and increasing that workforce diversity, these are things that we have to consider and we have to understand to really help support that mid-career nurse in transitioning. Thank you so much for this time today and for being able to engage with you all. This has been a phenomenal webinar and just a great opportunity for us here at WGU to be able to engage with the ANA and all of nursing.
Thank you, Janelle. Thank you so much. And thank you, Mike, and thank you, Corbett, and thank you, audience, for joining us today. Enjoy the rest of your day.